A research report at the Medical University of South Carolina's Pediatric Endocrinology Clinic indicates that children as young as 4 visited the clinic for transgender consultations. Now, as you might guess, this is a problem for some. Legislators in South Carolina were shocked that children so young might receive so-called gender treatment and announced an investigation into the hospital's practices. Now, current law in South Carolina prohibits the hospital from using state money to fund or support the gender transition of minors under the age of 16. And it should be noted that the hospital denied that such treatments are occurring. But as we see this expand, more and more of this is occurring. Joining me now to discuss this is Dr. Quentin Van Meter. He's a pediatric endocrinologist and president of the American College of Pediatricians. Dr. Van Meter, welcome back to Washington Watch.
Tony, always glad to be on your show.
Does this report surprise you?
No, this is what's happening at almost all the university-based transgender clinics, is that children are being brought in at young ages, as young as 4, sometimes even younger in Southern California. And the transition that's happening is at that point in time, at that young age, not a medical transition or a surgical transition, but a social transition. That sounds benign, like something reversible. But Dr. Kenneth Zucker, who was really a world's expert on the whole concept of incongruent gender, has soundly stated in his clinical studies and researches and published papers that a social transition is a disruptive event in the life of the child. It's opening a Pandora's box, essentially stating that the child is a gender that's not congruent with the biologic sex determined at the moment of conception. And so that child is forever torn asunder from within the family fabric, not only within the internal family, but in the social milieu around school and friends and families of the child's friends, who are essentially having to deal with the fact that out of the blue, in some cases, this child is no longer the sex that they thought the child was, or is not pretending to be the sex, and is choosing a different sex to emulate or appear to be. And that is, they look at it as a total reversible concept, but in truth, it is not. It's very hard to put things back in a box once you've torn that box open. At South Carolina, like most of the U.S. Centers for Transgender Affirmation, they are waiting until the onset of puberty, whenever that happens to naturally occur, to begin to use medical interventions, such as puberty blockers, and then very quickly after that, introducing cross-sex hormones. We know that the puberty blockers and the cross-sex hormones do irreparable damage. There is more and more literature being published about the effects on the adolescent brain that are we're now learning are very, very important and not reversible. Dr. Michael Biggs from Oxford University has just written a scathing article about the use of puberty blockers in transgender adolescents and young children just starting puberty, really pointing out the fact that there is absolutely no scientific evidence that it is safe for the adolescent brain to be exposed to these medications. So I think the comeback from University of South Carolina was, no, we're not transitioning small children. We're waiting until they're pubertal, of course, and of the age of consent. And the thing is that, no, they're really talking about social transition.
But they're putting them in the pipeline.
They're putting them in that pipeline. I call it a conveyor belt. Okay, it really is. It's a hard place to get out from once you're on that track. The concept that puberty blockers are a pause, where it's kind of like the reset pause of Hillary Clinton with Russia. It's actually a fake situation. They're using that as a reason to start the drug, and then in the clinics in the United States, very rapidly, those kids are placed on the cross-sex hormones so that they can, quote, enjoy puberty at an age match time with their peers.
All right, so Dr. Van Meter, you put a lot out there. We could talk about that all day, but there's a couple of pieces I want to break down just a little bit. I mean, we're talking about children. You said could be younger than 4 years old, but we have 4-year-olds that are being brought in. At 4 years old, I mean, you don't even know your ABCs. So how do you know about the birds and the bees? I mean, this is mostly going to be, is it not going to be environmental factors that are going to shape a kid to maybe do something, pick up a doll as opposed to a gun and, a toy gun? And so they're going to say, oh, he's a girl, and put him on this, as you say, conveyor belt?
Yeah, it's a situation that is untenable for a child to be able to understand the depth and the breadth of what that means. A child lives in a sort of a fantasy world, and the thing that scares them is when the line between reality and fantasy cannot be established. And that's where anxiety essentially pops in, and the mental health of that child is adversely affected when they really can't determine what's real and what's not real.
Right.
And that is a very scary situation.
But as you described, so this is just, it's not the drugs, and it's certainly not the surgeries at 4 years old, but they get on this conveyor belt, and now we have policies being passed in some states that says, look, you can't counsel that child about their gender dysphoria to move them back off that conveyor belt. I mean, you're essentially locking these children in for something that they acted out or thought about or may have. I mean, how in the world can a 4-year-old know what they want to be when they're 18 years old in terms of their gender?
It's absolutely an impossible thought. They can't even think about what gender really means, about reproduction, about family, about the purpose of their future life beyond the tip of their nose. I mean, they live, or their favorite thing. Are we there yet? I mean, that's every 5 minutes. So it's beyond.
This is criminal.
It is really just hard to wrap your head around the fact that anybody would even consider doing this.
Now, very quickly, we're almost out of time, but the World Professional Association of Transgender Health published new guidelines, and apparently in this new guidelines, they've removed basically the minimum age requirement. So now is it the wild, wild west when it comes to these transgender treatments for medical professionals?
The fact that they removed these was somewhat undercover. No one expected it. It was just sort of represented as a modified version with no explanation whatsoever about why that was done. That leaves speculation wide open to say that I guess anybody at any age. No one has really answered that question, and I think that until that question is really, and concretely outlined what it means, what did they mean when they removed the age limits? I think those guidelines have to be held in abeyance and just put on a shelf and reconsidered.
Dr. Quentin Van Meter, always great to talk with you. Thanks so much for joining us today.